Interacting with patients on a daily basis exposes you, your employees, and your practice to professional liability. And while it's pretty well known that doctors and healthcare providers need to carry malpractice insurance, one of the most common mistakes that we see is forgetting to cover your medical corporation. In today's episode, we're going to talk about malpractice coverage for medical corporations, why they need to be covered, how to get them covered, and what's the best and most cost-effective way to do so. Stay tuned. Welcome to Malpractice Insights, the show dedicated to helping healthcare professionals understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. My name is Jennifer Wiggins, CEO of Aegis Malpractice Solutions, and I'm so glad you've joined us today. If you're new to our channel, welcome. Thanks so much for being here. We release a new episode every week, both on YouTube and your favorite podcast streaming platform, so be sure to like and subscribe to stay connected. All right, let's jump in. So, who needs malpractice insurance? All healthcare providers and the practice itself. In the event of a malpractice claim, many people can be named, including the name on the door. Corporate malpractice coverage is a frequently overlooked item when determining who needs to be insured in your practice. Your business entity has vicarious liability exposure, which means that it is responsible for the actions of anyone working on its behalf. That includes you, your staff, or any independent contractors that you have working for you. When you obtain malpractice insurance for your business entity, make sure that all legal business names are covered under your malpractice policy. This includes DBAs or any legal entity name that is affiliated with your practice. If you are an independent contractor and you have an LLC, make sure that you get coverage for this entity when you obtain malpractice coverage for yourself. So, how do you go about getting malpractice insurance for a business entity or corporation? It's generally recommended that you secure malpractice insurance from the same company that you use for your own coverage. Carriers prefer to keep risks together, so if they insure you, they need to insure your business, since claims are likely to be affiliated. When you shop around for your malpractice quotes, make sure your agent is aware that you have a business entity that also needs coverage. There are generally two ways that you can insure a business entity for malpractice coverage: a shared limit or a separate limit option. Let's look at the shared limit option first. If you are a solo provider, meaning the only doctor working at the practice, most malpractice insurance carriers will allow you to list your business entity on your insurance policy at no additional charge. This option provides shared limit coverage for you and your entity. If, for example, a patient sues you, Dr. John Smith, and your business, Smith Medical Clinic, and then let's say your policy has a $1 million limit per claim, then you and your business will share the coverage for any claims made against both of you. Shared limits coverage is an easy, inexpensive way to provide protection for your corporation if you are a solo provider or just starting out in your practice. Shared limit options may also be available for partnership practices, but once you exceed 2 doctors in the group, generally the shared limit option will no longer be available. Once the practice reaches a certain size, you will be required to buy a separate insurance policy for your entity. But having a separate entity policy also affords you some additional coverages that may make it worth setting up sooner rather than later. If you purchase a separate policy for your business entity, this gives your practice its own insurance policy with its own set of limits. So if you, Dr. John Smith, have a $1 million, $3 million limit policy, and you buy a separate policy for Smith Medical Clinic with another $1 million, $3 million limit, then each of you have your own insurance policy with your own separate limits in case you're both named in a claim or suit. Separate entity coverage also provides a wider range of protection for mid-level providers in a group. Most malpractice insurance carriers allow all classes of allied professionals to be insured under the corporate policy at no additional charge. This is beneficial to doctors because they are no longer sharing their individual policy limits with their staff, but rather it provides a separate set of limits to cover the entity and all non-physician staff working under it. Corporate malpractice insurance costs are minimal. For a single physician practice, the corporate malpractice insurance is generally 10% of their individual premium. So if you're a doctor who pays $15,000 a year, then the cost for corporate malpractice insurance for you will be around $1,500. For groups, the corporate cost is around 10% of the top 5 physicians' premiums combined. So in this example, let's say we have a group of 10 doctors, and they each pay $10,000 a year for their malpractice insurance. The corporate malpractice insurance cost would be $5,000. So $10,000 times 5 equals $50,000 times 10%. The corporate malpractice insurance policy extends coverage on a shared limit basis, and coverage is generally limited to the acts done within the scope of employment. When an allied provider leaves a practice, they typically do not need to purchase tail insurance since they were sharing the policy with their employer. However, it is the employer's duty to maintain continuous coverage and to take care of that tail insurance at some point in the future, unless it's an occurrence policy. When you're working with an agent to get quotes for your malpractice coverage, be sure to provide them with a complete roster of staff for your practice, including the named entity and any other DBAs or affiliated businesses. Your agent can then provide you with coverage options and scenarios for both shared limits and separate limit policies so that you can compare costs and find the option that's right for you. If you have any questions on this topic or you want to make sure that you're covered appropriately, click the link in the description box below where you can connect with us via phone, email, or chat today. And if you're listening, please visit us online at aegismalpractice.com. That's AEGIS malpractice.com. We have some great episodes lined up for you in the next few weeks. Make sure that you're subscribed to our show so that you don't miss an episode. And if you found this information helpful today, could you do me a favor and give us a like and leave a review? Your feedback and support really does help us to reach more people, and we're grateful for your clicks and your kind words. That's it for this episode of Malpractice Insights, where we're dedicated to helping you understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. This is Jennifer Wiggins. Thanks for joining us.